My name is Kim. I am the Surgical ICU Clinical Specialist for the Department of Respiratory Therapy here at the University of Michigan. I started in medical records at Ferris State, and my father became ill, which led me to want to do more patient care as opposed to more office type scenario. So I went from medical records into respiratory care up at Ferris at that time. It means working in a place that I like to come to because I get support from my colleagues, I get support from the families, I get support from my friends. It's a great place to learn. It makes me want to come to work. That's the difference. Oh my gosh, there's so much here to offer. I mean, clinically, educationally, research-wise, it's phenomenal. I learn every day. My department offers me the opportunity to go to conferences, to learn new things about respiratory care. I do research in the ICU myself and have worked with some of my colleagues in publishing some papers about respiratory care. It's a great place. I mean, you learn something new every day. There's one incident that sticks in my mind, and I'm sure that everybody's aware of it. It was years ago when a Northwest plane went down here in Michigan, and we got a call. I was the manager on that night, and said we were going to be getting all of these patients from this plane crash. So I had to ramp up staff and call people, get them in here to get ready for this disaster, and it ended up that we only got one patient, a little 3-year-old girl who we had to put on a ventilator, and she was in the trauma burn unit for months. I mean, everybody as a team, mounted together to make her comfortable. Firefighters sent in, gifts of stuffed animals and all kinds of things. The staff just did whatever they could to make her feel comfortable and to get her better, to get her back home to her secondary family.